Sleep apnea increases your risk for several ailments related to the heart and cardiovascular system. This is a video you want to listen closely to. Sleep is an essential time for the body to rest and recuperate, and that includes your heart. The heart rate slows, blood pressure drops, and breathing stabilizes. These changes reduce stress on the heart, allowing it to recover from the strain that occurs during waking hours. Obstructive sleep apnea involves the repeated collapse of the upper airway during sleep. You essentially stop breathing, and it has the opposite effects on your heart and cardiovascular system. Think about times when you've been startled by something. Call it the fight or flight response. Among other typical physiologic responses to a scare, your heart rate surges and your blood pressure goes up. If you've ever been scared, you know what I'm talking about. This response is also what happens during the events of not breathing because of sleep apnea. Depending on the severity of your apnea, this can happen multiple times throughout the night. And each time it happens, among other things, it places an enormous strain on your heart without you even knowing it. The relationship between sleep apnea and your heart has received significant attention by the scientific community over the years. And we know that sleep apnea increases your risk for heart attack and stroke. Research shows that poor sleep contributes to atherosclerosis, leading to coronary artery disease. We also know that there's a strong association between sleep apnea and high blood pressure. There's a strong link between sleep apnea and an irregular heartbeat, otherwise known as arrhythmias, and this includes atrial fibrillation. The damage can even be deadly. Severe untreated sleep apnea increases your risk of dying from heart disease by 5 times. I was a bit hesitant to do this video. I don't want to come off as using scare tactics. But not too long ago, I treated a patient whose father died in his early 40s from a heart attack compounded by complications from sleep apnea. And as it turns out, his daughter has sleep apnea as well. The good news is that sleep apnea can be effectively treated, and we'll talk about treatment options in a future video. If you'd like more information about the Center for TMJ and Sleep Apnea, please check out our website at tmjsleep.com. Thanks for watching.